If you've ever been to the doctor, you've probably had your blood pressure checked. But have you ever stopped to wonder what those numbers actually mean? Today, let's talk about the difference between normal and high blood pressure, and why high blood pressure is often called the silent danger. Alright, so blood pressure is basically the force of your blood pushing against the walls of your blood vessels. Sounds simple, right? When you see those two numbers, like 120/80, they stand for systolic and diastolic pressure. Systolic is the top number, showing the pressure when your heart beats. Diastolic is the bottom one, measuring when your heart is resting between beats. Now, here's what's considered normal: a systolic number less than 120 and a diastolic number less than 80. That's 120/80 or lower. If your numbers are consistently higher, say 130/80 or more, you're entering the high blood pressure zone, also called hypertension. But why does this matter? Well, high blood pressure increases the pressure on your arteries and your heart. Over time, this can damage those blood vessels, making your heart work harder than it should. The scary part? Most people don't feel anything at all. No headaches, no dizziness, nothing. That's why it's called a silent danger. Left untreated, high blood pressure can lead to some serious issues, like heart attacks, strokes, kidney problems, and even vision loss. And since it often sneaks up without any symptoms, it's super important to check it regularly, especially if you have risk factors like a family history, extra weight, or a salty diet. So, what can you do? First, know your numbers. Get your blood pressure checked, even if you feel perfectly fine. Second, make some healthy choices. Eat more fruits and veggies, cut back on salt, stay active, and try to manage stress. Sometimes you might need medication, but those lifestyle changes really do make a difference. To sum it up, normal blood pressure keeps your heart and arteries happy. High blood pressure puts them at risk, without giving you any warning. So don't let this silent danger sneak up on you. Stay curious, stay proactive, and take care of your health. Thanks for tuning in, and remember, sometimes the most important changes are the ones you can't see.